Did you know that cats can have freckles inside their eyes? Not only that, but sometimes those things that look like innocent freckles could actually be the beginning of something more sinister. Or that certain breeds of dogs are predisposed to certain eye conditions. Join us on this week's episode of Vetsplanation, where we dive deep into what you need to know about your pet. I am your host, Dr. Sugerman, and today we're going to be talking to Dr. Karen Brantman, an ophthalmologist in the Pacific Northwest. Listen in to find out when you might need a veterinary ophthalmologist. Hi, everybody. Welcome back to another episode of Vetsplanation. So I have a super special guest with me here today. I have Karen Brantman here. She is a veterinary ophthalmologist, so I'm really excited to talk to you
Yeah.
today. Yes. So can you tell me, we're going to jump into just quickly, what is an ophthalmologist?
An ophthalmologist, and this is different from an optometrist. So a lot of people will ask me how I get dogs to read eye charts.
Yeah, exactly. Yeah.
And that's actually not something that I do. So
Yeah.
your optometrist, they can do a couple of diseases, but they fit you for glasses. The ophthalmologist does only medicine. So medicine and surgery really is the big
Yeah.
difference there. So I do medicine and surgery of the eye.
Nice.
Yeah.
And is it just the eye, or do you do surgery around the eye as well?
Yeah. So in animals, the ophthalmologist kind of does that whole area.
Yeah.
So I will do not only cornea and lens or cataract, and some of us do retinal work.
So retina is the back of the eye.
Retina is
correct?
in the back of the eye. But we also do the face. So the skin and the eyelids, which in dogs in particular, and some cats, the conformation and the way that they're made and put together can be a problem.
Yeah.
And so that's something that I actually work on quite a bit. So in human medicine, you'd have about 3 or 4 different people for all of those things.
That's how I feel as my job is as
Yeah.
well.
Yeah.
Like for my job, you'd have the emergency doctor and the surgeon and
Yes.
the radiologist, and
Yep.
exactly. Yeah.
Yep. So we wear many hats.
You were talking about that you do lots of surgeries and stuff as well. So
Yeah.
what kind of surgeries do you normally do?
Yeah. So starting with the skin. So there are mostly dogs, I would say, that where they'll have malformations. So they may have an eyelid that is flipped inward, right? So now you've got hair rubbing on the eye. That is a common thing
Yeah.
we fix depending on breed and the size of the dog, but I see that a lot. And it can cause a lot of pain. And so fixing those dogs isn't just a cosmetic surgery.
Yeah.
It really is for quality of life and
Right.
for eye health.
I can't imagine
Yeah.
my
I know.
my lashes touching
Yeah.
my eye all the
Yeah.
time.
It would be like your beard flipped into
Right.
your
Yeah,
eye.
exactly. It'd be terrible.
It'd be
Yeah.
a real challenge. Yeah. And so those are big ones that I do. Working our way in, there's also, so you've got an eyelid up here and an eyelid down here, and then there's a third eyelid in dogs and cats. Sometimes there are misplaced glands, and so I'll correct the position of the gland.
Crazy.
I do corneal surgery where if there's
So remind me what the cornea is.
Oh, yeah. So the cornea is the clear outer windshield of the front of your eye.
Nice.
So it's what you use to see through everything. Your
Yeah.
eye is the camera, and the cornea is that outer windshield
Okay.
that you're looking through. So the cornea can be punctured, lacerated, infected. So I treat all those things.
Lots of foreign bodies in there.
Yeah, foreign bodies. So
Yeah.
thorns, something to
Porcupine
stick-
quill.
Porcupine quills.
I've had that. Yeah.
Yes. So there are various things that you hope a dog would close their eye, and they sometimes don't. And so if that were something that needed to be removed or repaired, I would fix that for them. Working our way inside of the eye, so cornea, iris, which is the colored part of their eye, and the iris constricts and dilates and helps us focus. Behind the iris is the lens. And the lens is where cataract happens.
Yeah.
Yeah. So most people are familiar with cataract. It's a cloudy, the lens is supposed to be clear, just like the
Right.
cornea. So if there's an opacification there, then you can't see through it.
Right.
Not quite mud on the windshield, but issues inside the eye, inside the lens. And so people have cataract surgery, and we can do that in dogs and cats.
Very
so yeah, so
And
it's kind of neat.
the same thing, right? Cataracts in people is the same as cataracts in dogs
Correct.
and cats.
For the most part. Yep, absolutely. And the techniques that we use are adopted from human medicine. Obviously, they came up with the idea first.
Right.
And so, yeah, we use a lot of those same techniques and a lot of the same machines. Our instrumentation is a little bit different because of the size of the eye. And it also depends on the species that you're working on. So if you're doing a horse, for example, versus a dog, you would need different size instrumentation for that.
I can imagine doing like my little dog who's 8 pounds with the giant stuff that you use for a horse. It's not going to work.
It might not work very well. Exactly. And then the retina, which is all the way back to the back of the eye. The retina is like wallpaper that lines the back of the eye. And so there are surgeons who do retinal surgery in animals. We see the retina fall off the back of the eye. Sometimes it gets torn, so that can be surgically reattached. I don't do that surgery, but there are very special surgeons across the country that will do it. So
that's pretty cool.
It's neat.
So me as a emergency veterinarian, I can look at eyes somewhat. I can remove an eye, but there's not a lot else that I can do. So can you tell me, like, when is it appropriate for a pet parent to be able to see you versus come to see me?
Good question. And it's tough, I think, because a lot of it has to do with some of the instrumentation that you have, also your comfort level.
Right.
And
eyes are hard.
Eyes are tough, right? And just being able to, at least be able to start some basics. I would say that most signs that a pet parent is going to notice, all the eye signs fall into one of a few categories or a couple of categories. Squinting, discharge, cloudiness or a color change, and redness. That's it, right? All of those symptoms.
I will say there's one other one popping out.
Oh, yeah, popping out. The eyeball has launched itself.
I've seen, that's, I think, the majority that I see.
Oh, that probably is true. So barring the eye, actually called proptosis is what we call it. Barring that, most of the symptoms are one of those four things, and it could be something, it could be nothing. It could be a big deal. It could be not such a big deal. So a good place to start is always with your primary vet or your emergency doctor if your primary vet's not available. And I would hope that they would look for a couple different things. One, they should do tests for glaucoma, for pressures.
Checking the pressure of the eye.
And corneal ulcers, so the staining. And I suggest doing tear tests as well. And I would suggest doing all of those tests each time you look at an eye, because even as an ophthalmologist, you really don't know which cases need what until you get pretty far into your training. And I'm saying just by looking at them.
Absolutely.
So do yourself a favor, do all of your tests, know what you're dealing with, and then you can go from there and decide, okay, which medications am I going to try? Or, I think that's not great. Maybe I should send that. And then, so that would be, I guess the next step is, when do you send?
Right.
Or when do you say, okay, this isn't something I can do? Glaucoma is an emergency, so high pressure in the eye, but you can always start glaucoma medications as soon as you see these cases. And there's one glaucoma med that is safe to start. It's dorzolamide. And so I would say, if you think there's a pressure increase, regardless of the cause, that one is safe to use. And I wouldn't hesitate. There are other versions, other classes of drugs that might not be safe to use. I always stick with dorzolamide. That's my recommendation.
I think that is probably the only one I've ever prescribed.
Good.
That's like the basics of my knowledge of eyes.
Exactly. And so you can't, do no harm, right? And so get them started on something, and then we can send them to an ophthalmologist.
Do you always recommend having the pet parent going to an ophthalmologist after being diagnosed with glaucoma?
Good question. It's probably, obviously it's an ideal
Right.
scenario. There are different reasons for glaucoma occurring. Primary or genetic glaucoma, usually we'll diagnose that based on a breed, right? And exclusion, right? You don't see anything else wrong.
Right.
Those cases, there's only so much that I can do.
Yeah.
Now, the other scenario is that there's glaucoma as a result of something else going on that could affect overall health or just comfort in general, something we might actually want to know more about, whether there's a tumor or high blood pressure or something else going on. And yes, it's ideal to send to a veterinary ophthalmologist, but you could attempt to try to manage the pressures and at least try to preserve comfort as best you can.
Yeah.
And if you can't keep an eye comfortable and blind, removal is always an option, assuming overall health is okay.
And they do so well.
Oh gosh.
Just with one eye.
Yes.
I have 2 cats with one eye.
Yes.
Opposite eyes.
Oh,
Yeah.
they're buddies.
Yeah. Little bookends.
Yeah.
That's what we call it.
The animals will do fantastic without vision.
Yeah.
And without their eyes, one
Right.
or two. Obviously, it's great if we can try to keep that for them, but they compensate beautifully the vast majority of the time. Always comfort and quality of life is first, no question. And if that means eye removal, then that's okay.
Yeah.
Yeah.
So with glaucoma, that's usually a medical thing, not a surgical thing. Are there other big medical, like eye things that we should be sending our pet parents over to you for?
Yeah. Probably, I would actually say probably the biggest reasons to send things would be if there's some sort of surgical treatment that is recommended. Because you can always try some medical therapy, right? Even if we think there's an infection, you can try antibiotic drops. If we think there's dry eye, you can try tear production drops. What's the word I'm looking for? Stimulating drops. Yep.
Thinking of like I had, for example, I had a cat who his eye changed color.
Yes.
For no reason.
Yeah. So a lot of times that might be worth, if you're not sure about what might be happening, that would be worth sending it.
Yeah.
Because there's a couple of things that can cause overall eye color change, some of which you want to really stop that process if you can. And on the other hand, you could be looking at maybe even early melanoma or tumor formation in the eye. And having an ophthalmologist help determine when it might be time to remove that eye is probably going to be very helpful. I would probably recommend that.
When you've diagnosed a pet and decided probably the best thing is to remove the eye, do you usually recommend sending them back over to the general practitioner or the ER vet, or do you usually recommend having you guys remove the eye?
I am very comfortable removing an eye, which is it's almost like an occupational hazard and stuff like that, which is good and bad news. But is a nucleation difficult? I don't think so. I think it's more about how comfortable somebody is doing the procedure. And honestly, it probably has more to do with just doing it than not. And so, I would definitely, it might be helpful because there are a couple of common mistakes that I see. It would probably be helpful if someone's never done it before. Obviously, make sure you read, the book and the described surgical procedure, but it'd probably also be helpful to have somebody there with you who's done it before. Sometimes there's little anatomical things where you're like, is that what I'm looking for? And so it might be helpful to have somebody else there.
Yeah. That's definitely how I learned, is having somebody else there to show me.
I think mentoring is a huge part of eye work. That's how obviously I learned as well. You go through your residency and you have somebody right there with you who can teach you. So it's priceless.
You were talking about just residency right now. So can you explain to me real quick, like how you become an ophthalmologist? Because there's a difference between me and you then. So what is that difference?
Yeah. So a specialist has to go through additional training. And the way that we do it is you have your 4 years of veterinary school. you need to go through at least an internship. And this internship is general. So you're doing medicine and you're doing surgery. It's usually small animal, but some people do large animal.
Yeah.
And so you're supposed to have a good foundation in general medicine and surgery overall. From there, you need to complete an ophthalmic residency, but getting the residency is very challenging. It's very competitive. So people will often take extra steps in between their internship and their residency, whether they do a PhD or a master's or other sorts of research, or maybe they do an ophthalmology specialty internship, which is what I did. So I did an ophthalmology specialty internship where I also did more ER work at the same time. I really liked that because I got to work with even more people, right? You see how different people attack different conditions and how that works for them. And then from there, you do your residency. And that's, for me, that was a 3-year program. There are some that are 4-year programs. I'm glad mine was only 3.
You've already been at school forever.
Yeah, because otherwise it just feels like forever.
Right.
Yeah. And so it's a bit of a long haul, but I think especially for eyeballs and for those of us who really enjoy it, it's worth it. We love it. But that also, I think it's something to keep in mind that if you don't feel comfortable looking at eyes or don't feel like you quite know what you're doing, hey, it's okay. It takes most of us 5 years to get to the point where we can do these things.
Yeah.
It's always fine to ask questions and see what people think, or things you're not sure about, ask somebody. So
that's amazing. I can't imagine doing like more schooling than what I did.
Yeah, I know.
So what pushed you to not only, like, you wanted to be a veterinarian, but not only that, then you wanted to specialize in veterinary ophthalmology. Like, how did you get to that?
Yeah, I tend to be a very detail-oriented person. So diving deep on 1 or 2 topics is a little more interesting, or it's a little more stimulating for me than trying to do a whole bunch of different things. Plus, I think different people gravitate toward different things within medicine, whether that's surgery or this or that, or ER medicine, right? And so the other thing about ophthalmology, not only is it for very detail-oriented people, but I like medicine and I like surgery, so it lets me do both.
Right.
And I also wasn't sure for a long time whether, like, initially I wanted to do all exotics and zoo, and then I wanted to do horses, and then I wanted to do small animal. I know. So this lets me do all of that. And it focuses on one organ in multiple species, which is pretty neat.
Yeah.
Yeah.
And you had mentioned that you could do things like horses and everything. We were talking before about how you got to do a penguin, hawks, all sorts of cool animals, right? What other animals have you gotten to do surgeries on?
Penguins, python, that was pretty neat.
Yeah.
Penguins, python, some medical work on a grizzly bear, which was neat. Small birds, owls, hawks, and predatory birds of prey is the word I was looking for. Chickens.
Yeah.
Rabbits.
Yeah.
Ferrets.
A fish, if I remember
correctly.
Fish. A fish.
Yes.
That is crazy.
That was really neat.
Yeah. And so you remove the eye from the fish, right?
Yep, exactly. And the fish did amazing.
Yeah.
He did amazing. It was a zoo specimen. And I think people have traditionally, we didn't know how they would do if you removed an eye. Plus, people worry. There's lots of people, including children, that come through zoos. Would that be scary?
Right.
What would happen? And the fish had such a large eye. It was really protruding out of his head.
I'm sure it's so uncomfortable.
I can't feel good. And so we removed it. He did amazing for surgery, very simple surgery, and he healed within 7 to 10 days, and he was swimming around. He had zero problems with it, and he looked great.
Yeah.
I have a neat job that I get to help lots of different species in scenarios. It's cool.
And how we met was through a chimpanzee who had her eyelid torn.
Yes.
So I've did a podcast with them as well.
Yeah.
Yeah. And her eyelid was torn off. And so you had gone back in and repaired her eyelid.
Yes. And so she had already had one repair done. And unfortunately, chimpanzees like to pick at things, including sutures. So she picked out all of her sutures, and I think her vet had tried to put it back together a couple of times, and then I went back and I think I was the third person.
Yeah.
And so I tried to use a lot of buried sutures. I got most of it repaired, but there was still an area that she
Picked open.
But
Did you have to go back again?
I didn't. We decided to just let that try and granulate in or heal on its own. Yeah, exactly. And she ended up, because I got most of it closed, there's only one area right here. So it was a little like this and then just a little dip, and that was it.
It's not bad.
No.
Compared to what it was.
Compared to what it was, which was quite
right.
open. Yeah.
Yeah.
Oh, honeybee.
Yep. So I'm guessing you get called a lot for all these different exotic animals, like asking questions about them and stuff as well. Is that right?
I do sometimes, not as frequently as I would like. It depends on the areas where I've worked in different areas of the country. In one place that I was in, I was their go-to person for the zoo. Other places, I've worked with rehab centers. Here, there's a few different specialists, and I think I might not be the guy who got in there first.
I don't know. Maybe if you just put that out there.
Put that out there.
I'll see any zoo animals what we wanted to
which
do
I would love to
before.
do. Yeah.
Exactly.
Yeah. And I think that you're probably right.
Yeah.
Okay.
Yeah. You want an ophthalmologist?
I'm happy
That's
to
me.
help. Yeah, absolutely.
And then, so seeing an ophthalmologist, is that a really expensive thing usually?
Yeah. So I think recently in particular, we've seen an uptick in a lot of prices in veterinary medicine, and we've been affected as well. No question.
Yeah.
I would say that the initial we have there's not many of us, and it's really hard to get in.
Yes.
And usually that first examination will probably be relatively expensive. The subsequent examinations and follow-up care are less, but it can be a little pricey.
And what should somebody expect on their first examination with you?
Yeah. And price shopping may be something that somebody might want to do. See what's out there and what places are close to you and what might be more doable than another. But I believe that initial examinations, which includes what we call ophthalmic testing, so we're doing pressures for your animal and tear testing, and we're staining the cornea, and we're doing all these things. And so anywhere from probably 300 to 500, depending on where you go and where you live, that'd probably be a good ballpark start.
Yeah. If somebody had done tear staining and all the testing at their regular vet or at the ER, do you repeat it then?
Most of the time I do. And the reason for that is because it's more about tracking and watching trends than it is about, oh, I don't believe what they did.
Yeah.
Not about that.
Right.
For example, if I see a corneal ulcer and somebody diagnosed that, it might be a day or two or a week or a month since that person had the staining done for their animal. So I want to know, is it still open? What does it look like? What are their characteristics? Because all those things can change.
Yeah. And I definitely cannot describe like an ulcer as good as you can describe an ulcer. Mine's just like, it's in the middle.
Yeah. And there are certain things that I'm looking for when I stain. So I will stain the cornea and then I look at the cornea with a microscope. So I'm looking for specific patterns and the way the cells handle that stain and all of that.
That's usually not something that we have. We don't have a microscope to be able to see those things, which is why it's great for you to be able to see those things.
Exactly. And it does also take, people say that it's called a slit lamp. That's the handheld microscope that I use. And people say that for doctors to learn how to utilize it often takes 3, 4, 5 years. So it's not something that most people can just pick up and do, unfortunately. You have to get used to it and practice with it.
Yeah, I remember when I tried to do that like in school and I was like, I don't know. Yeah. I don't understand what I'm looking at.
Yeah, exactly. And there are some schools that don't even have their students look through slit lamps. People that I train or work with, I try to have them all look through it and know what it's like and see things up close, because I think you have a different understanding when you're using that instrument to look at that particular organ. It's not like other It's not
Right.
like a kidney or something
Yes.
like that.
Yeah.
It's different.
Exactly.
Yeah. And I was going to say things like, I would say the biggest thing with repeating those tests too is because really they are just like blood work. It's a snapshot in time. And
Right.
so much can change with the eye, even within 12, 24 hours.
Mhm.
So when they come to see me, I need to know where things stand
Yeah.
currently to be able to help.
Yeah. You mentioned that about blood work. I talk about that all the time. Because
Yeah.
people always be like, I got blood work done 6 months
Right.
ago. So it should
Exactly.
be like, how much could have changed? I'm like, everything.
Actually, a
Everything
lot.
could have changed.
Yes.
Yeah.
Yep. And one way I explain it, like with eye pressure, is like how your blood sugar goes up when you eat. Your eye pressure can go up at different times of the day. And that's normal. Those are
Right.
normal
Yeah.
variations.
With different like stress and all
Yep.
sorts of things.
Yes, absolutely. Absolutely. So it's worth to make sure we're doing everything correctly and treating correctly. It's good to repeat these things.
Yeah.
Yeah.
Good.
Yeah.
Yeah, because I know a lot of people ask, if we did the testing, does that mean they're not going to repeat the testing? Like, actually, they most likely
Yeah,
will repeat
probably
the
will.
testing.
Yeah. Yep.
Yeah, so it's really good information to know that why, because it's a
Right.
snapshot, not because you just
Right.
don't trust what I'm doing.
I'm looking for the trend, and even for my current patients, I like to have 6 months plus even 3 years of tears and pressure measurements, because I like to see when I did something, how did that affect things, or how did things change last time I did surgery, what happened here. And so it helps me manage, I feel like, the care better.
Yeah.
Yeah.
And how often do you have them usually recheck with you?
It depends. If it's a new current disease process that we're trying to get a handle on,
Yeah.
I might see them more frequently. If it's an infection, maybe even weekly for a couple weeks. But once things slow down, depending on what it is, I like to say some people actually graduate, right? So I'm like, come back if you need me.
Yeah.
See you later. And that's probably the best recheck follow-up
Nice.
plan anybody gets or recommendation. But I would say most eye diseases, unfortunately, a lot of them are managed. You can't make them go away.
Right.
So younger animals, I'll at least see them annually, usually, if they're controlled. Once I have pets getting up into 13, 14, 15, 16, which I see, I usually prefer to see them at least twice a year, because at that age, things can change even faster.
Yeah.
Sometimes I see them every 4 months. Yeah.
Do you have certain diseases in cats more than dogs, or in certain breeds more than other breeds?
Yeah, I would say cats, probably one of the biggest things that I'm seeing or that I try to manage is iris tumors. So we worry about melanoma of the iris, and we worry about it spreading to the rest of the body.
Yeah.
So that's why we try to track it so closely.
I think it's really important too to like showcase how like you had to do your internship with learning all about the body, because people think that the eye is very isolated.
They
but
do.
really,
Absolutely,
but it
right?
is really connected to almost everything else in the body.
And that would be, of the two things that I would have people know about the eyes, it's eyes are wonderful and fantastic, but you can live without one,
Yep.
right? And they can do great, and they
Right.
compensate, and they're okay if they can't see. So that's one thing. And then two, the eyes are connected. Just like your brain is connected to the rest of your body, so are your eyeballs.
Yeah.
And there are certain diseases of the body where the only thing we see is a sign in the eye, or maybe that's what people notice first, right? Because falling down the stairs or bumping into a chair is not expected and really noticeable for a
Or
lot
the
of
color change in
right.
yeah, those are things
Right.
you can like clearly
Really
see.
notice. Yeah. Yep. Where you can say to yourself, I don't think that's right.
Right.
And so for cats, I would say watching for the iris tumors. And the other thing for cats is blood
Real quick,
pressure.
can you tell me what the iris tumor looks like?
Oh, yeah. The iris melanoma type tumors. I should back up.
Okay.
So, irises, particularly in cats, we see it in dogs, but in cats, we worry about it more, where they can develop little brown spots. And the brown spots can be just that, little focal spots, or they can be webby patches.
Yeah.
Sometimes they can even go all the way around the iris. You can have freckles. It can be just a freckle, just like a mole on your skin can be benign. These can be benign.
So, and benign means
not a
say.
cancerous tumor that we worry about spreading or causing damage to other organs.
Yeah.
But the problem is that some of these can be what we call melanoma or cancerous malignant tumors. And we think that these can spread to the body with a pretty high percentage. Some of our understanding of these tumors is in flux, right? Just so many things with medicine. Right. But we think that they can spread really willingly and really fast before we get a chance to even get in between these things and the rest of the body. So we watch them and we look for things that might suggest that they're more sinister, like a big nodule or a really dark brown patch, something that changes really fast. Or if the eye seems like not only is it got brown coloring, but maybe it's not working right. The pupil doesn't look right. I would say those are probably the biggest things. Yeah.
Yeah. And then what do you see? What do you think people with dogs should look for more?
Dogs. Oh my gosh. Dogs get so many things. So if I would say probably two of the biggest things. Well, can we do three?
Yeah.
I'll do three.
Yeah. You choose your help.
Okay. So the first thing with dogs, and cats will get this too, they'll get corneal ulcers. They're squinting, they're red, you put your stain in, you diagnose a corneal ulcer, and you
It'll
use
show up as a little
a
yellowish
greenish
dot.
spot. Yep, exactly. And then we use an antibiotic to prevent infection while that heals. That's a relatively straightforward one. I would say the other two that I see are dry eye, so low tear production. And the reason why that's a big I would put that in the big three, is because one, you can rule it out or rule it in by testing for it easily.
Testing. Like we can do it in ER or GP.
Yep. Two, it's a huge contributor, if not the main contributor, to chronic discharge and redness. It contributes to vision loss via scarring. It can just do it can't feel good. It's irritating and it can cause vision loss.
Right.
And we can pretty easily figure it out and potentially treat it.
Right? At least manage it.
At least try. Yeah. At least try and do what we can. So that's why that goes in also the big three. And then probably the last one would be glaucoma.
Yeah.
And the biggest thing with glaucoma, elevated intraocular pressure inside the eye, is it hurts. It's like a headache. So you may not see them squint. There's only a handful of breeds that will come into the ER like this with a high pressure. Usually,
I think those are the Chihuahuas.
Yeah, or Shiba Inus, but they're screaming already anyway. Or teeth gnashing. Or a lot of times glaucoma, you may notice this, or maybe the third eyelid is up a little. But more than that, usually they might not want to. It's like a headache, so they might not want to eat as much, or they might sleep more. The way I think of it is, when you have a headache, you still go to work, but maybe you just don't feel great. Or you still eat, but you just don't feel great.
I feel like the other thing I see commonly with glaucoma is they're more snappy. A little more aggressive, and people are like, I just don't know. They just are like, they're more weird about me touching around their face.
I think that is probably true. And I think that a lot of eye disease in general, I will see that, where initially, because I think sometimes, especially if you have a little dog who might be snappy in general, you try to go toward the head and they're snapping at you, and you might think, oh, that's just my dog.
Yeah.
When in actuality, it's more about they don't want to be touched.
Right.
And sometimes the signs can be really subtle. Like on one side, I'll touch and they're like, oh, it's okay. And then on this side, they might do something as simple as that. So it's not necessarily biting, but I do see that.
Yeah.
Absolutely. And as dogs come in and I'm getting their condition controlled, it's actually a neat process, because maybe an animal is aggressive or painful when they come in, and then each visit they get easier and easier to handle, and then maybe actually even enjoy coming in, which is pretty fun. to see
Right.
that you're helping.
Yeah,
Yeah.
exactly.
It's pretty neat.
Yeah, very cool.
Yeah.
Yeah, it's just so interesting. I've always found eyes very interesting. We don't get a lot of training in it, I feel like.
Yeah.
So,
Yeah.
yeah.
Yeah. And I wish in human medicine, I think it's the same thing,
Mhm.
except if they're at a hospital, they're just saying to the ophthalmology resident, can you please come
Please
down?
exactly. I don't have that. I don't have
You don't
anybody I can
have
call.
that
Yeah.
option.
Okay,
Yeah.
can you come down here real quick?
Yeah. One thing I'm interested in looking at and that I think is really neat is doing teleconsulting with ER clinicians
Yeah.
or
General
primary vets,
practitioners.
just
Yeah.
general practitioners where you don't necessarily, if you have somebody you can send a case to, great. But there are areas where there's nobody.
Right.
I'm number
Exactly.
491 in my college. That's how many of us there are. It's not
That's
that
crazy.
many. Yeah.
Yeah. And that's over like, I don't even know how many.
North
years.
America.
Yeah. Like, but
Yeah.
that's like over like what? I don't even know when ophthalmologists
Exactly.
started.
That's since the 80s
Like
and
70s,
90s.
yeah.
I'm number
Yeah.
491, having finished in 2013.
Yeah.
And
Yeah,
there's
really not a lot.
there's not a lot of us.
Yeah.
In reaching some of those rural spaces or just the ER clinicians overnight, I think would be a really neat option and something I'd like to leverage. I
Yeah.
think it'd be really cool.
Yeah, that'd be really cool.
Yeah.
Yeah, 'cause there's so many times that,
Yeah.
like I said, like, or people who can't get out to you.
No.
Like, my wife is a nurse, an RN, and she has a lot of patients that she sees that are homebound.
Yes.
And there's no way
Can't
for
come.
them to get to you.
No.
Yeah, they have to send somebody else to usually send them to me. So some really nice neighbor has
Yes.
brought them to me.
Or a family member. I
Right.
have that as well.
Exactly.
Yep.
And then I'm like, hey, you're gonna have to go see an ophthalmologist
Yeah.
because I can't give you an answer. That's even harder.
Yes, exactly. Yeah, there's a couple of new, it sounds kind of hokey to say it, but it really truly is a couple of different ways of reimagining veterinary care and bringing
Absolutely.
care to people or pets that wouldn't necessarily have it otherwise,
Right.
all through video
Yeah.
and teleconsulting. And I can, granted, not to put less emphasis on the stuff that I can do in person because
Yeah, 'cause you can't
obviously,
do a slit lens.
obviously there are
the
things
telemedicine.
that help me out a lot when I'm looking at an animal in
Right.
person, but I can do a lot to start care
Right.
by looking at photos, videos, the way the animal moves,
Yeah.
how they're holding themselves in
Walking and things.
yes, and in consultation with someone else who's got feet on the ground. I can do a lot.
Yeah.
So I'd like to do more with
Yeah.
that.
Yeah. We
Yeah.
still help. Like I
Yeah.
said, like this, we just don't get a lot of ophthalmology
Yeah.
work. So it's really hard sometimes for us to be able to do those things unless
Yes.
somebody's been like really diligently studying
Exactly.
those things.
Exactly. And also, I think, whereas you see a lot of eyes throughout a year, right? But I see 20 pairs of eyes every day.
Right.
You're probably seeing 20 pairs of eyes maybe
Probably.
in a month.
Yeah.
Yeah. So it's a little different.
Yeah.
I mean, you're seeing it, but it's not
Right.
all the time.
Right.
So,
Exactly. Yeah. Very cool. And can you tell me, like, if we do want to see a veterinary ophthalmologist, how do we find a veterinary ophthalmologist?
Yeah. So a great way to do it is to probably, one of two ways, Google veterinary ophthalmologist. And then when it asks you to click in your area, you say yes. And so that is one option. You would want to look for an actual ophthalmologist, someone that's labeled as an ophthalmologist.
I do see, like, when I've Googled it sometimes,
Correct.
that
Yeah.
like a general practitioner will pop up.
Correct.
I'm like, well, I know this is incorrect.
Correct.
Yeah.
Exactly. So you want to see ophthalmologist either after their name or in their job description title or even in the clinic title. So that's one way to do it.
What are the letters after?
Oh,
for
good. That's a great
ophthalmology?
question. So the letters after my name are DACVO, Diplomate of the American College of Veterinary, which is everybody has that.
Yeah.
And then ophthalmology.
Nice.
Yeah. O at the end. And our college, so the College of Veterinary Ophthalmology, has a website for people to go through specifically to look up somebody near them.
Yeah.
And you can put in a name. You can put in a city or a state or a zip code. You can look within a certain mile radius of whatever location you want to.
Nice.
So that might be a really great way for people to look up people.
And I know it's so hard to get into an ophthalmologist. I do
Yes.
usually tell people call multiple.
Yeah.
Whoever has the first opening, you take that
Yeah.
one.
I would say that would probably be the best way to go, especially if there's something worrisome or that's concerning. You should really take the first one that you're offered just for the health of the pet and the eye.
Absolutely.
I would say if there are certain breeds that tend to be more predisposed to eye problems, where even if nothing is wrong, or you think nothing is wrong, you may want to have an ophthalmologist in your contact list, just so that make that appointment, make a non-urgent appointment so that you're already in the patient base. And that way, when you do have an emergency, you can call your ophthalmologist directly.
And what kind of breeds are those?
Boston Terrier. I would say Boston Terrier is one of the top breeds. They have just about all of the issues, and many of them have multiple issues. Cornea, tear problems, cataract, glaucoma, all the things. I have several Boston Terrier parents who they have experience with it now. So they get a new puppy and they just bring it in when it's 1 or 2 years old and get it checked out.
Nice.
Pugs would be another one. English bulldogs.
I was going to say bulldogs is my
Yeah.
I was thinking of.
Yeah. And I like to tell people any dog with a smushy face is at risk for having eye issues, just like they're at risk for so many other health issues. But Boston Terriers, pugs, English bulldogs, and then the one other one that I would say you might want to get checked out, even if you think everything is okay, is a little bit different. It's a golden retriever. And the reason is because we have relatively recently detected a really serious disease for these guys. Which
another one?
I know. And it is a genetic disease. And so the breeders are breeding, but you don't detect it as a baby. You detect it when they're older. And it's insidious, meaning that they can have it and you don't know it until it's bad. So it's a disease that causes inflammation and glaucoma in the eye, so they can go blind, they can be painful. And trying to start treatment early, we think can help. So if you have a golden retriever, probably having an eye exam every 1 to 2 years, starting at 4 years old would be wise. And once they're 6 to 7, I'd probably say every year.
Wow.
Yeah.
Poor guys. Like,
I
they
know.
just get everything.
I know. I know. The worst.
They're so nice.
I know. They're such nice dogs.
Jeez.
Yeah.
Isn't there another one? I could be wrong. Because again, I'm not great at eyes.
Yeah.
I feel like there's like huskies had some sort of genetic eye problem.
One of the biggest genetic, are you thinking of
Collie
eye anomaly? Yeah. So that's an interesting one, which one of the whole reasons the college started and eye certification exams for breeders started was because of collie eye anomaly.
Wow.
Yeah. So these dogs are born with congenital malformations.
Yeah.
And they can be mild or they can be severe. And the mild ones aren't that bad, but if you keep passing those genes on, then you could have a dog that gets severely affected. And those dogs are blind and all of that. When those dogs are young, that you bring them into the ophthalmologist and you take a look and you can know, hey, maybe I'll breed this dog, but not this dog. So if they have a lesion early in life, it can be easy to know. And a lot of that disease has been stamped out because of what we've done, which is great.
It's amazing.
Yeah. I mean, if you think of, of all the diseases, that's really cool. Problem with a disease like the golden retriever, it's called golden retriever uveitis. A couple of different names for it now, is if they get it late in life, you don't catch it on the eye certification exam. There's also some genetic testing that can be done these days.
Oh, cool.
For various eye diseases.
Do they have one for the golden one? Or?
I think there's a gene that has been identified. I don't know if there's testing available yet for it. The That's a great question. But some of the inherited retinal degeneration or lens diseases, and of course, we haven't identified all the genes, but
Right.
so many of the conditions are genetic, and we've identified a few so that breeders can know, hey, should I breed this one or not?
Do you usually send the testing to like UC Davis for those things, or will you tell people do the embark or?
Yeah. So there's a couple of different options these days. It used to be OptiGen was one. I think Embark does actually, if I recall
I
correctly.
can't remember if it's a wisdom panel or embark, but one of them.
Yeah. And they can do an entire, not just eyes, but there's just many body systems. And so I have a breeder for one of my dogs, and she was telling me all about it, and I was really impressed with all of the things you can test for. It's neat.
I had mentioned Addison's to one of my pet parents, and they're like, oh, let me show you her genetic testing.
Oh, yeah.
And I was like,
yeah. And I will have some dogs that come into me now, every now and then, when a pet parent may say, oh, I think this is happening for my dog. Here's the genetics testing that she had. Is this what she has?
Yeah.
And then I can confirm or deny.
Yeah, it's just like another piece of the puzzle.
Yes.
This does fit with everything.
It just fits with everything. Exactly. Yeah. It just helps us keep our dogs even healthier if we can avoid some of those things.
Yeah. Very cool.
Yeah.
So where can we find you at?
So I am probably best searched for either Google. You can do my last name, but you can also,
which is actually hyphenated, by the way.
Oh, yeah.
I don't know if it says on there, so I just want to make sure, because like my name is hyphenated, so not everybody finds me.
Oh, okay.
Yeah.
And if you put in Brantman,
Yeah.
that should be sufficient.
Perfect.
And I believe on our college website, the ACVO website, you could probably find me under Brantman.
Okay. Yeah, with mine, like you can look up Sugerman.
Yes.
People get very confused because they're like, there's another last name on there. So is this the correct
Oh,
Sugerman?
yes. And so the married name is Crosetto.
Yeah. Perfect. Was there anything else you want to share with us?
I think we covered it.
Perfect. Thank you so much. Like I learned so much from what we were talking about just now. So I'm really excited about that. So thank you.
Oh, gosh.
Coming down
my pleasure.
Yeah. Perfect.
Yeah, it was really great talking with you.
Great.
Thank you so much.
Thank you. All right. Thank you, guys. Make sure to keep your pets happy, healthy, and safe. We'll see you next week. Thanks. I wanted to give a huge thank you to Dr. Brantman. I learned so much about ophthalmology on this podcast and just about how cool her escapades are in general. She's a pretty awesome lady, and I can't wait to have her back on to talk more about eyes. Also, thank you as always to Sean Heiberg for editing the podcast and answering all of my technical questions. And Kelly Riopoli, sorry if I messed that up, Dwyer, for always helping me with my website. You guys are amazing. Make sure you catch our future episodes on pet first aid kits and are cats actually nocturnal? Thank you to everybody for keeping your pets happy, healthy, and safe.